Welcome, everyone, and thank you for being here today. I'm excited to introduce our presentation on the comprehensive overview of lung and chest wall anatomy and physiology. The subtitle highlights that we'll be exploring structure, function, clinical conditions, and respiratory mechanics. Over the course of this session, we'll cover these key aspects to give you a clear understanding of how the lungs and chest wall work together. Let's get started. Today, we'll discuss common clinical conditions that affect the lungs and chest wall. Understanding these conditions is vital because it helps us grasp their medical significance and how they impact patient health. We'll look into how the blood supply and lymphatic system of the lungs play a crucial role in maintaining lung health, ensuring proper oxygen exchange and immune function. Additionally, we'll highlight the function of the diaphragm and the importance of the pleural membranes, which are essential for effective breathing. Finally, we'll explore the shape and surfaces of the lungs, as these features are key to understanding how respiration works. All of these elements come together to give us a comprehensive understanding of lung and chest wall anatomy and physiology, which is the foundation for recognizing and managing respiratory conditions. Let's take a closer look at the apex of the lungs. The apex is the uppermost, rounded part of the lungs, and it's quite significant because it extends above the clavicles or collarbones. This means that the top of your lungs actually reaches just beneath the neck area, which is important for understanding lung anatomy. Moving on to the shape of the lungs themselves, they are conical when inflated. This conical shape isn't just a coincidence. It actually helps the lungs expand efficiently within the chest cavity. This design allows the lungs to fill the space effectively during inhalation, maximizing airflow and oxygen intake. Finally, let's consider the base of the lungs. The base is the lower part, which is concave in shape and rests directly on the diaphragm, the large muscle that plays a crucial role in breathing. The connection between the lungs and the diaphragm is vital because it facilitates the movement necessary for respiration. Understanding these key parts, the apex, the conical shape, and the base, provides a solid foundation for grasping how the lungs function within the chest wall, supporting the overall respiratory process. Now, let's take a closer look at the surfaces of the lungs and their significance. Starting with the costal surfaces, these are the smooth, rib-adjoining surfaces that come into contact with the inner chest wall. They play a vital role in how the lung interacts with the chest cavity, allowing for smooth movement during respiration. Next, we have the mediastinal surfaces. These are concave areas that border the mediastinum, which is the central compartment of the thoracic cavity. The mediastinum contains essential structures such as the heart, aorta, esophagus, great veins, trachea, and main stem bronchi. Because of this, the mediastinal surfaces are crucial for accommodating and protecting these vital components. Now, moving on to the overall view of the lung surfaces and mediastinum, one interesting feature to note is the cardiac notch. This is a distinct indentation on the anterior border of the left lung, specifically designed to accommodate the shape of the heart. It allows the left lung to fit snugly around the heart, ensuring an efficient fit within the thoracic cavity. Understanding these features helps us appreciate how the lungs are structured to optimize their function while accommodating the surrounding vital structures. Let's take a closer look at the structure of the diaphragm. The diaphragm is a dome-shaped muscle that separates the thoracic cavity from the abdominal cavity. Its lower margin is situated around the T10 vertebral level, while the highest margin is located between T8 and T9. This positioning is important because it influences how the diaphragm functions during breathing. Now, an interesting aspect to consider is the influence of the heart on the diaphragm. The heart pushes down on the left side of the diaphragm, which can affect its overall position and shape. This interaction is significant because it highlights how the structures within the chest cavity work together to facilitate respiration. Moving on to the role of the diaphragm in ventilation, it's actually the primary muscle responsible for breathing. Its structure and position are crucial because they enable it to contract effectively, creating the negative pressure needed to draw air into the lungs. Finally, let's touch on the difference in position between the right and left sides of the diaphragm. The right hemidiaphragm is positioned higher than the left, mainly because the liver pushes it upward. Recognizing this anatomical difference is key when understanding how the diaphragm functions within the chest wall. All these points underscore the importance of diaphragm anatomy and physiology in respiratory health and function. Let's take a closer look at the hilum. This is the area where arteries, veins, and bronchi enter and exit each lung. It's a vital structure because it serves as the connection point between the lung and the circulatory and respiratory systems. Without this, the lung couldn't effectively exchange gases or be supplied with blood. Moving on, we have the lingula. Think of it as a thin anterior part of the left upper lobe that actually overlaps the heart slightly. It's an interesting feature because it plays a specific role in the anatomical structure of the left lung, helping us understand how the lungs are organized and how they fit within the thoracic cavity. Now, if we compare the lingula to other parts of the lung, it's actually the counterpart of the right middle lobe. This symmetry and the differences between the two sides highlight how the lungs are designed to accommodate the heart and other structures. Recognizing these parallels helps us better understand lung anatomy and its functional significance within the respiratory system. Now, let's explore the role of the pulmonary ligament in lung suspension. This ligament is essential because it helps suspend the lungs within the chest cavity. Essentially, it acts like a supportive strap, ensuring that the lungs stay stable during the various respiratory movements we make. Without this stability, the lungs could shift or become displaced as we breathe. Next, let's locate the pulmonary ligament. It is situated just below the hilum, which is the central area where vessels and bronchi enter and exit the lung. The ligament serves as a connection point between the surface of the lung and the diaphragm below. This positioning is vital because it links the lung to the diaphragm, helping to maintain proper positioning during breathing. Finally, the pulmonary ligament functions as a structural connection. It acts like a stabilizer, linking the diaphragm to the lung's surface membrane. This connection is key for maintaining the integrity and proper mechanics of the lung within the thoracic cavity, supporting the overall respiratory process. This understanding ties into the broader theme of how the anatomy supports efficient lung function. Let's take a closer look at the intrapleural pressure, which is actually subatmospheric, meaning it's lower than the surrounding atmospheric pressure. This negative pressure is crucial because it helps keep the lungs expanded. It essentially balances the opposing forces at play. On one side, the chest wall has a tendency to expand outward, and on the other, the lungs tend to recoil inward. The intrapleural pressure maintains this delicate balance, ensuring smooth and effortless breathing. Now, surrounding the lungs is a potential space called the pleural space. Inside this space, there's a thin layer of serous fluid that acts as a lubricant. This fluid is incredibly important because it reduces friction during respiratory movements, allowing the lungs to glide smoothly against the chest wall during inhalation and exhalation. Moving on to the pleural membranes themselves, the parietal pleura lines the inner surface of the chest wall. Think of it as the structural support for the thoracic cavity. It helps attach everything securely in place. The visceral pleura, on the other hand, covers the surface of the lungs directly. It plays a vital role in protecting and enclosing the lungs, facilitating their movement within the thoracic cavity. Together, these membranes form a continuous, sealed envelope around each lung. This seamless connection between the visceral and parietal pleura creates the pleural membrane, which is essential for maintaining the negative pressure and allowing the lungs to expand and recoil efficiently during breathing. Understanding this relationship is key to grasping how our respiratory system functions so seamlessly. Let's take a closer look at the clinical significance of the costophrenic recess. This area is a common site where fluid can accumulate in cases of pleural effusions. Because of its unique position at the lowest part of the thoracic cavity, it becomes a key area for diagnostic imaging. When we perform imaging studies, fluid buildup here often signals underlying issues, making it a critical area to evaluate. Now, to understand its anatomical location, remember that the costophrenic recess is where the diaphragm meets the chest wall at its lowest margin. Interestingly, The lung borders do not extend into this recess, but the parietal pleura does. This distinction is important because it explains why fluid tends to collect in this space. The angle formed by the costophrenic recess is called the costophrenic angle, and it's particularly important in diagnostics. When fluid accumulates in this recess, it can be an indicator of various pleural or pulmonary conditions. Detecting even small amounts of fluid early on can be crucial for effective treatment, as it may reveal underlying problems that need attention. So, in summary, the costophrenic recess isn't just an anatomical feature. It's a vital indicator in diagnosing and managing thoracic conditions. Recognizing fluid accumulation here allows us to identify issues early and tailor the appropriate treatment strategies. Now, let's delve into pleural effusion and its clinical relevance. When we look at chest X-rays, one of the key features to identify is fluid settling into the costophrenic angles. This causes a blunting of their normally sharp outline, which is a crucial diagnostic sign. Recognizing this helps us confirm the presence of a pleural effusion. So, what exactly is pleural effusion? It's essentially the accumulation of fluid in the space between the layers of the pleura, often resulting from inflammation of these membranes. This inflammation can cause excess fluid to build up, and we typically identify it through a combination of clinical symptoms and imaging studies. In terms of treatment, our main goal is to remove this excess fluid to relieve symptoms and improve lung function. Common procedures include thoracentesis, where we use a needle to aspirate the fluid, or inserting a chest tube to drain it more efficiently. These interventions are designed not just to alleviate discomfort, but also to restore normal respiratory mechanics. Now, it's important to understand how pleural effusion impacts lung function. The accumulated fluid increases pressure within the pleural space, which hampers the lung's ability to expand properly during inhalation. This can lead to respiratory distress and a decrease in oxygen levels, making it a significant concern in patient care. Overall, recognizing and managing pleural effusion is vital because it directly affects breathing and oxygenation. Being able to identify these radiographic signs and understanding the underlying causes allows us to intervene effectively and improve patient outcomes. Let's talk about penetrating chest wounds and how they can lead to pneumothorax. When there's a penetrating injury, like a stab wound, it breaks the integrity of the chest wall and, importantly, the pleural seal. This disruption is critical because it starts a chain of events that can compromise lung function. Now, once the pleural seal is broken, the subatmospheric pressure inside the pleural space comes into play. Normally, this negative pressure helps keep the lung expanded. But when it's disrupted, air from outside can be drawn into the pleural space, filling the gap between the lung and the chest wall. This accumulation of air is significant because it begins to push on the lung, causing it to collapse, a condition known as pneumothorax. And this lung collapse isn't just a minor issue. It leads to considerable respiratory distress. That's why immediate medical attention is crucial to manage the situation effectively and prevent further complications. Understanding this process helps us see the importance of prompt intervention in penetrating chest injuries to preserve lung function and ensure patient safety. Now, let's take a closer look at the pulmonary artery and its crucial role. The pulmonary artery carries oxygen-poor blood, which is blood that hasn't yet received oxygen, from the right ventricle of the heart to the lungs. This step is essential because it initiates the process of oxygenating the blood. Without this transport, the blood wouldn't be able to pick up oxygen and deliver it to the rest of the body. Next, we have the role of the pulmonary veins. These veins are responsible for returning the oxygen-rich blood back from the lungs to the left atrium of the heart. This process ensures that the blood is now fully oxygenated and ready for systemic circulation, which means it can supply oxygen to tissues and organs throughout the body. Now, connecting this to the overall picture, the blood supply to the lungs through pulmonary circulation is a key part of what keeps us alive and functioning. It's a continuous cycle. Deoxygenated blood is sent to the lungs, oxygen is picked up, and oxygenated blood is sent back to the heart for distribution. Finally, let's discuss gas exchange in the pulmonary capillaries. All blood passing through these tiny vessels is where the magic happens. Here, oxygen from the alveolar air diffuses into the blood, and carbon dioxide from the blood diffuses into the alveoli to be exhaled. This exchange is vital because it maintains the proper balance of oxygen and carbon dioxide in our body, which is essential for cellular function and overall health. So, in summary, the pulmonary arteries, veins, and capillaries work together seamlessly to ensure our blood is properly oxygenated and our body's gas exchange needs are met efficiently. Let's now turn our attention to the bronchial systemic circulation. This part of the circulation arises directly from the aorta and is responsible for supplying blood to the airway walls. Its main role is to ensure that the bronchial tissues receive the oxygen and nutrients they need to function properly. An important concept to understand here is the existence of an anatomical shunt between the pulmonary and bronchial circulations. This connection allows blood to move between these two systems, which is quite significant for the overall physiology of the lungs. The shunt causes a mixing of blood, specifically oxygenated blood from the pulmonary veins mixes with deoxygenated blood from the bronchial veins. This blood mixing has a direct impact on the oxygen content that reaches the systemic circulation. Because of this mixing, systemic arterial blood ends up having a lower oxygen partial pressure than the alveolar gas. In other words, the presence of this shunt and the blood mixing process reduce the oxygen levels in the blood that's circulated to the rest of the body. Understanding this process is key to grasping how the lungs balance their oxygen exchange and how blood flow dynamics influence overall oxygenation. Now, let's talk about pulmonary circulation blockage. When a blood clot gets lodged in the pulmonary circulation, it can effectively block blood flow through the lungs. This is a serious problem because it interferes with oxygenation, meaning the blood can't pick up enough oxygen to supply the body. Such a blockage doesn't just affect the lungs, it can lead to a range of clinical complications, impacting overall health. This brings us to a critical vascular issue known as pulmonary embolism. It's a significant problem because it directly affects lung function and can pose serious risks to both respiratory health and overall well-being. The disruption caused by a pulmonary embolism can be life-threatening if not addressed promptly. When we think about clinical implications, the key point is that impaired oxygenation can lead to severe complications, like respiratory failure or even cardiovascular collapse. That's why timely diagnosis and immediate treatment are absolutely essential. Recognizing the signs early and intervening quickly can make a life-saving difference. Throughout this presentation, we've seen how vital proper lung and chest wall function are for overall health. Understanding how blockages like pulmonary embolisms occur and their impact helps us appreciate the importance of prompt management in maintaining respiratory health. Now, let's take a closer look at the lymphatic flow pathways within the lungs and chest wall. Lymph travels through both deep and superficial systems, and importantly, it's directed toward the hilum, which is the area where the vessels and nerves enter and exit the lungs. This pathway is crucial because it ensures that lymph is efficiently drained from the lung tissues, helping to maintain fluid balance and support immune surveillance. Essentially, it acts as a cleaning and defense system, keeping the lungs healthy. Moving on to the composition of lymph, it's a clear fluid that contains proteins and is derived from blood. Blood gets filtered into the interstitial spaces, and this filtered fluid becomes lymph. This process is vital because lymph helps regulate fluid levels in tissues and plays a key role in immune function, effectively carrying immune cells to where they're needed. Now, focusing on the lymphatics of the lung, particularly capillary filtration. The capillaries in the lungs filter about 30 liters of fluid every day into the surrounding tissues. This might sound like a lot, but it's a normal part of how our lungs function. This filtration is essential because it supplies nutrients to lung tissues and helps remove waste products. Without this constant exchange and filtration, the lungs wouldn't be able to perform their vital functions effectively. Overall, understanding these pathways and processes highlights how intricately our lungs are connected to the immune system and fluid regulation, which are fundamental themes in maintaining respiratory health. Let's talk about normal fluid dynamics in the lungs. Every day, approximately 30 liters of fluid filter from the capillaries into the interstitial space. Now, most of this fluid, about 27 liters, is quickly reabsorbed back into the capillaries, which helps maintain the balance. The remaining 3 liters are returned to systemic circulation through the lymphatic system. This process is crucial because it keeps the lungs from becoming overwhelmed with fluid. If fluid clearance is impaired for any reason, excess fluid can accumulate in the interstitial space. When that happens, it can lead to flooding of the alveoli, which is what we call pulmonary edema. Pulmonary edema is a serious condition because it floods the alveoli, impairing gas exchange significantly. This makes breathing difficult and can cause respiratory distress. That's why the lymphatic system plays such an important role. It helps clear about 3 liters of fluid each day, returning it to circulation and preventing fluid buildup in the lungs. So, maintaining this delicate balance is essential for healthy lung function and effective respiration. Now, let's look at how changes in intrapleural pressure can affect breathing. When there's fluid in the pleural space, it alters the mechanics of intrapleural pressure itself. This means that the normal pressure gradient needed for lung expansion during inhalation gets disrupted. As a result, the lungs don't expand as efficiently as they normally would. This change has a direct impact on the pressure required to inflate the lungs. Specifically, when there's a large pleural effusion, it takes more force, or more pressure, to expand the lungs. The accumulated fluid actually restricts lung expansion, making it harder to breathe comfortably. So the key takeaway here is that fluid buildup in the pleural space not only affects pressure dynamics, but also significantly impairs lung inflation. This is why patients with large pleural effusions often experience shortness of breath. Think about how this ties into the overall theme. Understanding these physiological changes helps us better appreciate the challenges faced during respiratory compromise and guides us in managing such conditions effectively.